Hello, my topic this week is encephalitis, and this week I did a poem. Meningitis is inflammation of the meninges of the spinal cord and brain. Bacterial and viral organisms are most responsible for this migraine. Organism entry is allowed through head trauma and surgical procedures. Infection of the head, neck, or throat increases the risk due to proximity of anatomic structures. The organism may cause irreversible neurologic damage. Increased intracranial pressure can also be a disadvantage. Viral meningitis is the most common type, undisputed, sometimes referred to as aseptic meningitis due to its isolation from culture of the cerebrospinal fluid. Bacterial meningitis can be highly contagious and can be quite serious. This is likely to occur with high populations such as military barracks and crowded living areas. Standard precautions are needed unless bacterial meningitis is diagnosed with confirmation. The droplet precautions will be used to prevent spread and contamination. A neuroassessment is needed to detect signs and symptoms. Photophobia, hemoparesis, and muscle pain are some suspected predictors. Vital signs and neurochecks should be performed every 2 to 4 hours precisely. Also monitor for presence of vascular dysfunction and seizures periodically. For your assessment, when assessing a patient with meningitis, a neurological and neurovascular assessment is important. Common signs and symptoms often include fever, nuchal rigidity, photophobia, phonophobia, headache, myalgia, nausea, and vomiting. The patient may also be confused and altered consciousness may also present. You may also see a maculopapular rash with an enterovirus organism and a petechial rash with bacterial meningitis. Seizures can also occur due to inflammation of the cerebral cortex. The inflammation can cause excessive amounts of ADH, which will result in water retention. System inflammation can also occur, which can cause a rapidly falling blood pressure and tachycardia. The most significant lab test used in the diagnosis is the analysis of cerebrospinal fluid by lumbar puncture. Counter-immunoelectrophoresis may also be performed to determine the presence of protozoa in the CSF, or cerebrospinal fluid. To identify bacterial source of infection, specimens for gram stains and culture are obtained when indicated. White blood cell counts are usually elevated above normal value. X-rays of the chest, ear, sinuses, and mastoid are obtained to determine the presence of infection, and a CT scan or MRI may also be performed to identify increased intracranial pressure. For your nursing diagnoses, they include ineffective tissue perfusion related to cerebral edema as evidenced by delirium. Another diagnosis is disturbed sensory perception related to decreased level of consciousness, increased intracranial pressure as evidenced by altered sensory. For planning, patient's motor, cognitive, and sensory function will remain within acceptable parameters to the patient during my shift, and patient will maintain normal level of consciousness during my shift. For your implementation, meningitis can be prevented by teaching people to obtain vaccinations. Vaccinations are available to protect against Haemophilus influenza type B, pneumococcal, mumps, varicella, and meningococcal organisms, all of which can cause meningitis. The most important nursing interventions for patients with meningitis are accurate monitoring and documenting of the patient's neurological status. Cranial nerve testing is important in determining the development of hydrocephalus, which is indicated by the inability to move the eyes laterally. For medications, to avoid life-threatening complications, the healthcare provider will usually prescribe a broad-spectrum antibiotic until the results of the culture or gram stain are available. Once results are available, the appropriate anti-infective drug to treat the specific meningitis will be given. Bacterial meningitis generally requires a 2-week course of IV antibiotics, and drugs to treat increased intracranial pressure or seizures include mannitol, a hyperosmolar agent, and antiplastic drugs. Steroids are recommended for patients with Streptococcus pneumoniae meningitis, and also patients with Neisseria meningitis should have a preventive treatment with rifampin, ciprofloxacin, or ceftriaxone. For your evaluation, patient maintained motor, cognitive, and sensory function during my shift, and patient maintained a normal level of consciousness during my shift.